So a lot of folks ask what to expect after surgery. Well, in the immediate surgical period, like literally the day of surgery, I do want you as a patient to get up and walk. Walking is going to be very good to help you to prevent blood clots and also help with your breathing. And also the other things that I would like to get done from the first day after surgery, you're going to start on liquids and gradually progress you over time. After surgery, we do want that you keep to certain minimums. Initially, it's going to be hard, but over time, you'll be able to get these amounts. In terms of your fluid intake is really important. And on the average, we'd like you to get at least 64 ounces of fluid daily. This is going to include water, any Gatorade Zero, and your protein shakes. Now, we do understand that drinking water on its own can get boring, but water is still the ideal fluid to get. So things like Gatorade Zero or adding Crystal Light to your water can actually help, so you don't get too bored. Taking protein after surgery is paramount. The amount of protein required is dependent on the surgery that you have. For patients who've had the gastric sleeve or the sleeve gastrectomy and the gastric bypass, aiming for an average of 70 to 80 grams within the first 3 months of surgery. 70 to 80 grams a day within the first 3 months of surgery is important. After that, we kind of go down a little bit to 60 to 80 grams of protein every day. For those who've had the duodenal switch, the protein requirement or protein goal should be between 80 to 120 grams a day. Getting an adequate amount of protein, an adequate amount of fluids will help to prevent dehydration and at the same time give you the energy levels that you need. Your multivitamins are another integral part of your post-surgical care. I usually recommend you starting your multivitamins, your bariatric multivitamins to be precise, 14 days after your surgery, from your day 15. Now, very often folks say, hey, are over-the-counter multivitamins the same? And the answer is no. Patients who've had weight loss surgery require some specific vitamins, and these are present in the bariatric specific multivitamins versus the over-the-counter multivitamins. So that is important for you to stick with those kind of vitamins. After about 6 months from your surgery, we're going to be seen in the office on a regular basis, every 6 months. But from the 6-month mark, we're going to check a set of labs to ascertain your nutrition level, your vitamin levels, and make sure everything is okay. At each visit, we evaluate your weight loss, we evaluate your vitamins to make sure that you're doing fine. If for any reason we notice that your vitamins are low, we have to adjust what vitamins you're taking. If we find that you're not eating enough, then we can talk about you seeing our dietitian again in order to adjust your diet appropriately. Now, with bariatric surgery, one important aspect of the entire post-surgical care is your exercise. I always encourage activity from the day of your surgery for you to get up and walk. The first few weeks, first 4 to 6 weeks after your surgery, I do expect that you keep going, keep your activity levels. We're trying to walk around as much as you can. No sitting around and being a couch potato. That's not good for you, for your recovery, to delay your recovery and unfortunately put you at a high risk of some complications, especially blood clots. Significant exercise starts from about the 3-week mark. From about the 3-4 week mark, I do start encouraging patients to start doing stuff like going on the treadmill, going on the elliptical, or even a stationary bike. And if you're into outside biking, yes, from the 3-week mark is a safe time to start. From the 4 to 6 week mark, that's when you can start lifting weights. And I usually encourage patients from the 3rd month to start doing some strengthening exercises. Muscle strengthening exercises with lifting weights, doing crunches and things like that. What that does is to tighten the muscles underneath the skin to reduce the amount of excess skin that you will have. The current recommendation is for you to have 30 to 45 minutes of exercise 3 to 5 times a week. And one thing I always say is you got to be patient with your body, but work hard at increasing your exercise every time you go, and you will begin to see the difference on your own.